There are several things that people with these conditions can do to help improve symptoms and return to a normal pattern of passing stool. The following strategies have been developed with expert physiotherapy and medical input to help people with diagnosed anorectal dysfunction. If you are having difficulty passing bowel motions or emptying your bowel well, you may find the following advice useful. Eating a balanced diet with enough fibre, fruit and vegetables is important. A balance of fibre can help with both hard or very loose stools. It's important to drink enough fluids, ideally water, so that you keep your stools soft and smooth and easy to move. Even with loose stools, you need enough fluid to allow the fibre in your diet to work well, bind and create more formed bowel motions. Try to avoid constipating medications, and this can be discussed with your GP. Or try to avoid foods you notice which make you strain in the toilet. Any straining can place extra pressure on the muscles, possibly making things worse. A good technique on the toilet is helpful. It's important to have a good setup so things run smoothly. Sit with a box, step or footstool under your feet so that your knees are higher than your hips. Lean forward to rest your elbows on your thighs, keeping your back straight. Do not hover, try to sit well and relax. Breathe deeply into your tummy, feel it swell outwards and be soft and relaxed. As you bear down or push, try not to hold your breath. Take a deep breath and then blow or make a hiss or shh sound as you push. Shush to push helps to relax the pelvic floor and sphincter muscles and makes going easier. Don't rush and try not to strain. Timed toileting is another good strategy. Attempting a bowel motion at least twice a day, usually 30 minutes after meals. Try to have your breakfast first thing and go to the toilet within 30 minutes of this. If you need to, try again after your next main meal. Then while on the toilet, use the good techniques we've just discussed. Try not to strain too hard, as this may cause the muscles to tighten further and be counterproductive. Try not to spend more than 5 or 10 minutes on the toilet, and avoid using a finger to remove any stool as much as possible. If you must, make sure you have short fingernails and wash your hands thoroughly before and afterwards. Regular exercise is also a good idea. Try 20 to 30 minutes every day if you can, and is particularly useful after breakfast to stimulate the bowels. Mindfulness has also been shown to contribute to gut health. Take some time to relax the mind and reduce stress. Use some mindfulness apps or online guided relaxations. A regular routine of just 10 minutes daily has been shown to be useful in reducing stress and can have a positive impact on bowel symptoms. Diaphragmatic breathing is another strategy. It's useful to focus on your breathing during toileting. This helps to relax your tummy and pelvic floor muscles, making bowel emptying much easier. Simply rest your hands on your tummy and feel it rise with a slow deep breath in and then fall as you have a long breath out, in for 4 seconds and out for 7. It's useful to practice this breathing technique at regular intervals so your body recognizes it and can use it when you need it, for example on the toilet. If you continue to struggle with difficulty emptying your bowels, having tried these strategies, you might benefit from referral to a specialist pelvic health physiotherapist who can assess your pelvic floor muscles and help with treatments such as biofeedback or muscle retraining. You can discuss referral to a physiotherapist with your specialist consultant or GP. So remember, take adequate fluid and fibre. Take your time on the toilet and avoid straining. Use a good position, remember that footstool. Try the shush to push. Take some daily exercise. Practice mindfulness. Regularly practice your diaphragmatic breathing. And if you continue to have difficulties, see a specialist pelvic health physiotherapist.
I hope you have enjoyed our video. Please feel free to view any of the other videos available on our channel, and thank you for watching.